Hello. Hello, everyone.
Hello, Andrea.
Hi, Aida. Doctor, can you hear us?
Yes.
How are you? Thank you so much for taking the time and everybody for joining us today in this Pink Power panel. We're going to talk about breast, breast health in general and breast cancer prevention. We have a fantastic panelist here. We have Dr. Mols Melman. She is the Director of Clinical Breast Services at Boca Raton Regional Hospitals, Christine E. Lynn Women's Health and Wellness Institute. So she's a brain power and an expert in the subject. Thank you so much for joining us.
Thank you for having me. Thank you.
Thank you. And then we have Aida Estes. She's a warrior. She's a breast cancer survivor. She recovered from breast cancer 9 years ago. And one of her techniques to get better and find mobility again was Pilates. She loved it so much that now she dedicates her life to teach Pilates. So I'm gonna give you a couple of minutes of like to each one of you guys to introduce to the audience and to tell them anything that they should know about you. Let's start with the doctor.
Okay. So I work here at the Women's Center and I specialize in breast health. I see women with any breast concern. Women need to know that there is a center that they can go to if they think they feel a lump, if they're unsure, is something different than what it should be. Sometimes there could be common concerns such as having breast discomfort, or maybe they notice nipple discharge. Could be any concern. The point is that that whenever a concern is noticed, it should be addressed appropriately. I also see women who are proactive in their breast health. So women who want to come in when they have their imaging and also have a clinical breast examination. That is an important part of annual breast cancer screening. So, and it's also important for women to know what is their risk of developing breast cancer. So here at the center, I perform breast cancer risk assessments to help define what is a woman's personal level of risk of developing breast cancer, and based on her personal level, come up with a customized breast imaging schedule or breast imaging recommendations that are personalized to her level of risk. I also spend a great deal of time discussing breast cancer prevention, what a woman can do to reduce her risk of developing breast cancer, and there are important strategies that can be implemented. And here at the center, we also have a very special program called the Moving Forward Program, which is a special program for our breast cancer survivors to address the particular needs and concerns of breast cancer survivors and to ensure that they are being followed and imaged appropriately. And I also see patients here at the center who need to have breast biopsies performed. I coordinate their care, and we can go into more detail in that in a little while. But I just wanted to summarize the different aspects of my practice here at the Women's Center.
Thank you, doctor. Aida, and then tell us a little bit about you.
Yes. Thanks for having me first. Thanks, My Body Social and Baptist Health, and Doctor, of course, and Andrea. My name is Aida. My story is as a patient of recover from cancer, right? In my prior life before Pilates, I'm a software engineer. I worked 35 years plus in the corporate world as a software engineer. And about 9 years now back, right, I had breast cancer. It didn't come as a surprise to me. I had a family propensity. My sister had breast cancer 3 times, not only once. So it sort of runs in the family. So I was very well taken care of with a Baptist health team of doctors as a preventive measure before I actually got it. When I got breast cancer 9 years back, I used Pilates after all the surgeries that I went through to recover my last stretch, right? After treatment, after physical therapy. I use Pilates for my own complete physical recovery. What I found is that it helps tons, I mean, a lot, in the emotional recovery. So I knew then that I want to do something with it. But I was still in my corporate life. And by the time I was with Microsoft Corporation. And well, fast forward a few years after that, actually 4 years back, I opened the studio. So now I just hung the boots from the corporate world, and I'm dedicating the rest of my life, hopefully, right, in helping people like me to fully recover. When I say recover, it's not from the medical standpoint, it's more from the emotional standpoint, the definitely physical in terms of range of motion, especially of the arms and the chest muscles if you got mastectomy or something like that. But, you know, Pilates is mind, body, and spirit, and it's where that fits very nicely into, you know, a lifestyle, either as a prevention or as, you know, post diagnosis and recovery.
Fantastic. I love that you found your soul or your alma there with Pilates. I'm a Pilates fan. I love it. I started doing Pilates after my knee surgery and I love it. I fall in love with it and I practice every week. I love it. And let me tell you a little bit about me. So my name is Andrea Minsky. I'm a proud Latina. I'm a mom of two boys. I'm a TV host and a content creator. I am also the founder of Mujer Balance, a platform when we talk about balance because I really believe in the power of having body, mind, and soul aligned. So I have a question for you, doctor. I want to know about, and this is something that somebody yesterday, I was promoting the event today, and somebody told me, can you, I'm working at that time, but please ask this to the doctor. That there is any correlation between the emotional part because she has a sister that is going through this and she believes that she's having breast cancer because she has a really big loss in her family and she feels that the breast cancer is just a reaction of the emotional part. So I want to know if there is a correlation between the two.
So you're asking, is stress, is that a possible cause of breast cancer? You know, I think that stress is contributes to all sorts of physical complaints, but to the best of my knowledge, that there's no link to from stress to causing cancer. Of course, you know, what happens with stress is it does interfere with our body's mechanisms to fight off you know, abnormalities that may occur. So it can impact the immune system, but typically speaking, the cause of cancer is a result of changes or defects that occur in our DNA and affect cell growth. And those take, you know, those sorts of changes accumulate over many years. So although stress may impair our body's ability to have a strong immune system, I wouldn't say that that's the cause of breast cancer. Um, so you know, I think that when someone gets a diagnosis of cancer, often their first reaction is why me? You know, what did I do wrong to develop, you know, breast cancer or any other type of cancer? And often I tell my patients, you know, don't look for something that you did, you know, to blame yourself. There's many factors that play a role in the development of breast cancer. So often to blame any one thing that a person has done, you know, usually that's not the answer. We know that there's many factors that play a role in the development of breast cancer. Family history is one factor, one important factor, but there's many factors, including a woman's reproductive history. Does she have a history of breast biopsies? Does she take hormone replacement therapy? What is her breast density? So there's many factors that play a role in the development of breast cancer, and we can't just look to blame one particular issue or concern.
Okay, but do you feel there is any correlation in emotions? Because some people feel that when you are like when somebody have like a big stress in their life, not just like economically, but more sentimental. That like that's what they are telling me. Like when you are emotional, sad or something like that, that can trigger something that you have there in your genetic, and then it can appear. Is that a
You
myth?
know, I like I said earlier, I think that that cancer originates when there's mistakes that occur within the DNA,
Okay.
and DNA controls all the functions of our cells. And if there is a mutation or a defect in the DNA, then cells don't perform normally, and those cells have the ability to replicate and reproduce and produce more and more abnormal cells that don't function normally. But from the time you go to a change in your DNA and actually manifest with a breast tumor or an abnormality on imaging, you're typically speaking of years. That's not something that occurs, overnight, or a month of stress or 6 months of stress. You're typically talking about something that has occurred over a period of years until it finally manifests itself. Of course, when we pick up abnormalities, we don't want to pick up something that's well established. We want to try to pick up something that is in its very earliest stages. And we want to detect something in its very earliest stages, and that's why we encourage annual breast imaging. For people who are considered at higher risk of developing breast cancer, then those women are likely going to be followed more closely. So your average risk woman will have breast imaging once a year, their annual screening mammography. But for women who are considered at intermediate risk or considered at higher risk of developing breast cancer, they're likely going to be imaged every 6 months. Annual mammography once a year, but we can introduce supplemental forms of breast imaging to help capture breast cancer in its very early stages. And supplemental forms of breast imaging might include breast ultrasound. It might include breast MRI. We also have something called molecular breast imaging. So the point really is to identify women who we believe are at higher risk of developing breast cancer, and then initiate a customized breast imaging schedule to offer them not only more frequent imaging at 6 month intervals, but also offer them more advanced forms of breast imaging that have the greater capability of picking up breast cancer.
Fantastic. So it's being proactive, really important.
Yes.
Aida, I want to know what saved your life.
What was that? You broke
saved
up.
what
Okay,
saved, like
yes.
you tell me,
Actually,
okay,
it's
I'm
a
here
perfect.
alive, I have this
It's
beautiful pilates
exactly
studio.
what Dr. just explained, right? I mean, I'm so glad to hear that. So the rest of the audience can understand how important this is to have a doctor you trust that can map your risk, right? That was exactly my case. Okay, so I want to share this. My sister got her first breast cancer when she was just 31, right? I was 30. By then, I'm just a year older. So right away, they rushed me to a mammogram at 30 because my sister was 31 with breast cancer already. And that was my baseline. So I knew my baseline at 30 already showing a very dense, tissues, some calcifications that are usually something that, well, my flag something. And I was moving to the US by then from Argentina. So it was pretty stressful moment, right? Moving countries with that diagnosis from my sister. So I got paired with, by then already, almost 20 years back more. I mean, I don't want to tell my age, but it is a long time ago, right? With Dr. DeGargopian at Baptist Health. And exactly what the doctor just said. So they pair me with every 6 months, right? By then, my sister tested negative from the most common breast cancer mutations available at the moment. Negative, okay. And I remember one phrase from Dr. D that said, well, you're not guilty of those two, but there's such a universe of possible mutations of DNA that we don't know of, right? So this is almost 25 years ago. And I've been so close monitored that we knew, and I had that peace of mind that if I would get breast cancer, would be very early stage. And that's exactly what happened. after 15 years of monitoring, complementing every 6 months, a regular mammogram, an MRI with contrast, when they became available in the last few years of my closed screening, is when the MRI with contrast showed an area of concern that was not there 6 months ago. And yes, it was a very aggressive type of cancer, but because thanks to that, we caught it super early, right? And that's the story. So the story is that I think that close monitoring saved my life, which is your question, right? Understanding and being proactive of the options, and then making a decision, right? Because by then, my sister already had her second occurrence of breast cancer, which was not considered a recurrence, was like a second principal cancer for her, completely different from the first one. And then that was piece of information that I thank her because I could use it. She had cancer already twice and she's 40, right? So I was 44 when I got diagnosed, and then I didn't take any chances. I went as the doctor recommended with a bilateral mastectomy. Was the right decision? I believe that for me it was, but that is very personal. So the important thing is understand your risk, have doctors that can recommend the course of action, and then of course decide what you think is best for you, right? Then my sis had a third recurrence, so can you imagine? And then by then she had bilateral mastectomy. I'm sure she's not going to be mad at me if I'm sharing this, right? Mm-hmm. But why, some people ask why she waited. Well, she didn't wait that long. The doctors in Argentina where she lived had a different book of recommendations. I'm not blaming anyone. I'm just saying that this is not exact science, right? Every case is different and should be treated as such.
So one thing I would just like to add, two things I would like to add is that one, I do want people listening to understand that MRI does have capability of picking up things that mammography and ultrasound can miss. And that's why it is important to identify women who should have breast MRI as part of their annual screening. And the reason why MRI is so highly sensitive in its ability to detect abnormalities is because it involves the use of intravenous contrast agent. And when tissue is growing abnormally, it's going to have an increased blood supply, and that's where contrast goes to. And the radiologist sees an area that enhances. So I want our audience to understand that MRI has greater capability than mammography and ultrasound. I also want everyone to understand that if you have an annual MRI, it doesn't replace mammography. It's in addition to mammography. And the way to think of it is each form of breast imaging, each modality has its strengths and weaknesses. So one doesn't replace the other, but instead when you combine, you're increasing the overall value of your screening. And I also want to say, and this is what Aida, I hope I'm pronouncing your name right, said, and I find this to be very, very consistent with my patients, is that when women who are concerned that they're at higher risk, when you place them on a customized breast imaging schedule and you image them at 6-month intervals, what it truly does is it gives them peace of mind. They have tremendous peace of mind in knowing that they're being followed more closely and that they're being imaged with more advanced forms of breast imaging. So those are the things that I wanted to stress.
Yeah. And Andrea, you mentioned before, you asked doctor before about your friend and the emotions, right? And I completely agree. I mean, and science, I agree with science actually, right? That there's no clear link in between that. But when you are a high risk woman, right? And family mutations proven or not, peace of mind in knowing that you're in the right course. And knowing, because that I knew from the get-go, right? It was years on the making, right? But I knew that because of the schedule and the team of doctors that were screening me and helping me out, if it would come, doctor said it, I mean, my doctor didn't think if, he think it will, right? But it was a matter of when, and then you catch it early. And we know that when we talk about breast cancer, and lots of people still talk about prevention, and this is Aida saying this, right? I think prevention as such is more early detection than prevention, right? That's been proven to be key in a successful survival rate and treatment, right? So
So can
that's
I
peace
add
of
on
mind.
onto that? Can I
Sure.
add on to that? So, I mean, I absolutely agree with you that one of the most important things we can do is early detection. And in fact, that's why women are living longer, because lesions are picked up at very, very early stages when they're curative. And by picking them up at early stages, their treatment is going to be less aggressive. And they're gonna do very, very well. But I do want to say that there actually is things, we do have the means of actively trying to prevent breast cancer. So some involve lifestyle changes, such as trying to maintain a normal body mass index. It has been shown that women who gain weight, particularly after menopause, are increasing their risk of developing breast cancer. We also know that estrogen is produced in the fatty tissue, and that becomes significant after menopause because your ovaries stop working and estrogen is still produced in the fatty tissue. So women who are obese likely have higher levels of estrogen production. We also know that alcohol is linked to a higher risk of developing breast cancer, and we encourage women to drink no more than 1 glass of alcohol per day. We also encourage exercise. Not only is there impact on lowering risk of developing breast cancer, but of course you're also helping to prevent other diseases such as heart disease, high blood pressure, diabetes, high cholesterol. But what I want to add, because many people probably don't know this, that there are drugs we can intervene with prescription medication that have been proven to substantially reduce the risk of developing breast cancer. So for women who are considered at high risk of developing breast cancer, there's drugs such as tamoxifen, which many of you may have heard of. There's also drugs known as the aromatase inhibitors. And those drugs have been shown to decrease the risk of developing breast cancer. In some women who have had breast biopsies that showed atypical cells, when they go on such medication, they can actually reduce their risk of developing breast cancer up to 85%, which is very substantial. So we need to identify women that are appropriate candidates for such medication, because like with anything, there's always risk versus benefit. And we always want to choose individuals who the benefit will outweigh the risk. But I do want to point out that there is medication that has been proven to decrease the risk of developing breast cancer. So we can be proactive in terms of our screening, and we certainly should be, but we can also be proactive in terms of reducing the risk of developing breast cancer.
Thank you, doctor. And you have been talking a lot about risk and risk assessment. So I want to know, what is risk assessment? And because everybody knows that if it's a family history, you are at high risk. But what else? You talk about
So, excellent question. Excellent question, because a lot of women are of the understanding that if they don't have a family history of breast cancer, they don't have to worry about getting breast cancer. And the truth is that 75% of women with a new diagnosis of breast cancer don't have any substantial family history of breast cancer. So if that's what you're relying on, you're perhaps doing yourself some big injustice. So we know that family history is important, and I'm not downplaying it. I'm just saying that there are several other risk factors. But what I do want to point out with family history is that we look to see who are the relatives in the family that had breast cancer. Certainly, if a woman has a relative that's a first-degree relative with a diagnosis of breast cancer, like Aida, meaning having a sister or having a mother, that's going to have more impact on their risk than women that have more distant family members with a diagnosis of breast cancer. In addition, if a woman has a family member who is diagnosed at a younger age, also like Aida, in which a family member was diagnosed before the age of 50, that's likely to have higher impact on that woman's personal level of risk. But to answer your question, what are other risk factors? Well, we also want to know, is there any family history of ovarian cancer? Because having ovarian cancer in the family and some other cancers, such as pancreatic cancer or aggressive prostate cancer, that too might have impact on a woman's risk of developing breast cancer. We look for certain things in her reproductive history, such as how old was she when she started to menstruate. If you menstruate at an age before the age of 12, that has some impact on breast cancer risk. How old were you when you gave birth to your first child? Giving birth after the age of 30 or never having given birth at all has positive impact on breast cancer risk. And how old were you when you entered menopause? Entering menopause after the age of 50 also has impact on breast cancer risk. The commonality in these reproductive risk factors is increased levels of estrogen exposure. So if you started to get your periods at age 10, or if you entered menopause at age 55, you've been exposed to higher levels of estrogen for a longer period of time. And women who take hormone replacement therapy, they're also impacting their risk of developing breast cancer. The longer you take hormones, the more impact on your breast cancer risk. So lots of things fall under reproductive history. We also want to know, has a woman ever had breast biopsies? Even if the biopsies were benign, that does get factored in her risk calculation. The more biopsies, the more impact on risk. And sometimes certain pathology is identified that, although it's benign, is considered high-risk pathology, in which we know that having identified such pathology, that woman would be considered at significantly higher risk of developing breast cancer in the future. Another risk factor that I want to, well, there's two other risk factors that I want to mention. The first one, I'll just start off by saying advanced age. And often this comes up in which women come in and see me and they say, well, I'm 75, I've always had normal mammograms. Do I still need to have mammography? The answer is absolutely yes, because the risk of developing breast cancer actually increases throughout life. So your risk in your 70s is higher than what it was in the 60s and higher than what it was in the 50s. So there's no absolute cutoff in which we say, okay, you're such and such age, now we're going to stop screening. So as long as a woman has a good quality of life and is active, she should continue with annual breast imaging, because advanced age is actually one of the most important risk factors in the development of breast cancer. The next risk factor that I want to mention that is very important that a lot of women may not be aware of, and that's high breast density. So high breast density is a finding on the mammogram. Okay, high breast density is not related to breast size. It's not related to what the breasts feel like. It's a finding on mammography, and it's all about the proportion of glandular tissue to fatty tissue. So breast tissue is composed of glandular tissue. Breast tissue is also composed of connective tissue and fatty tissue. But when a woman has a higher proportion of glandular tissue to fatty tissue, she has high breast density. And it gives her mammogram the appearance of a patchy whiteness. And that patchy whiteness can obscure an underlying finding. So often women go for their mammogram, they get a negative result, they say, I'm fine, I don't need anything additional, I don't need a breast examination, and they go home, and sometimes, some women, months later, it could be 5 months later, they feel a lump while they're in their shower. Is that lump brand new? Was it not present when they had their mammogram? Well, there probably was an abnormality, but it wasn't detectable because it was hidden by high breast density. So it's extremely important to know your level of breast density and to be imaged appropriately. So generally speaking, for women who have high breast density, I will supplement their mammogram by breast ultrasound, and that will improve the value of their screening. But to answer your question more directly, breast density is not only something that impacts on imaging, but it's also a known risk factor in the development of breast cancer. So women with high breast density will have 4 to 5 times the risk of developing breast cancer compared to women with low breast density. So there's many important risk factors that go into the calculation of a breast cancer risk assessment, and there's computer models that will incorporate all the various risk factors that I've mentioned. And these risk models will calculate a woman's risk of developing breast cancer over the course of her lifetime and over the course of the next 5 years. We use those calculations to come up with a customized breast imaging a recommendation along with risk reduction strategies based on personal level of risk.
Thank you so much. So that's really important that you have like it's a different method depending on your body type and your different
Absolutely.
needs. So that's really good that you use technology to and to tell like the patient, okay, you have to do this, or like that there is people like you that specialize in that and can give you like the directions to do it. So Aida, I have a question for you. So I'm sure like people that are watching us, maybe they're not going through any of this, but I'm sure they know somebody, they have a friend, they have a family member. What recommendation do you have to support our people that are going through this, like something that help you, like because you don't never know what to say, what to do, like what do you think is appropriate to help somebody in this battle?
And this is beyond breast cancer, right? We always want to help somebody that we love. I would ask them what they need. I would ask, right? Because I mean, sometimes out of wanting to help somebody, you said something and it landed the wrong way, right? Offer help, but help, maybe your definition of help is not the definition of help they need. So I always ask, what do you need? But if it's too broad question and you don't get an answer, like, I don't know, we're fine, thank you, right? Depends on the level of confidence. Just offer, let's say if it's a mom with little kids, sometimes the help is lift some weight out of them in the normal daily task activities, right? When they start already recuperating from breast cancer, there's a moment of you're so joyful, right? Yes, you made it. But then it could happen that you get a downturn in your emotions, and there is where I see friends of mine or family members that went through similar things. They might need the most help. So I don't offer recommendations. I offer questions. What do you need from me? Do you want me to take the kids out so you can have a quiet afternoon? Do you want me now, from my new profession standpoint with Pilates, I offer Pilates once that person is able to start moving again, right? With the doctor's authorizations, right? I always offer, right, free sessions for somebody that wants to try, somebody just recovering. Um, movement helps with the emotions, helps with recover not only physically but your mind, your spirit, right? Joseph Pilates, the creator of the method, used to say, right, is mind, body, and spirit all mingle. We're humans because we have that spirit side of it. So I would offer that type of support. Sometimes it's more mundane, as I'd say, help with the house, with the kids, with whatever that person needs. Sometimes it's more individual, right? Take the a few hours for yourself to start exploring with movement how you feel. And it does happen, because it happened to me, and it happens that you might break into tears just moving, and people say, I don't know why I'm crying. Well, just cry. You've been very tense with a lot of things going on. Movement is like um, being yoga, being Pilates, walking, whatever that is. Moving will bring out those emotions to the surface, right? Don't fight them, let them be. And it's what I can help the most now, right? Through Pilates, to let the person, get that emotions out. And from there starts the healing from the emotional side, right? But what I want to say is that when a woman goes through, for example, mastectomy, you go through, uh, people don't tell you, right, what is going through that. What is that? You're fighting it, you do what you have to do, but then once the threat of the disease is gone, yeah, you're with a new reality, right? You look different, you feel different. And it's when starting to work on yourself and allowing those emotions to come out and be what they have to be is very important, because sooner or later they catch up with you, right? And yes, you will feel whole again. You will feel the movement. And for me, movement is everything. And this is way before breast cancer, right? So for me, recuperating my range of motion of the arms was very important. And once you achieve that, you feel more empowered, right? And when you're empowered in one sense, you feel more confident in other senses, right? So either at work or with the family or with a friend. So it's for me, it's important to understand what the person needs, and if you have the relationship, the close relationship, ask what that is, right? And you'll be surprised.
I love it. So communication is the key. You have to ask.
Yes.
What's the
From my perspective, I see breast cancer survivors, and I see that many of them, even though they're well, they're healthy, many of them suffer from anxiety or from fear of reoccurrence. And so, one of the most important things to me is to ensure that they're being followed appropriately, often seeing them twice a year, and once again, following them from an imaging standpoint more closely, because that gives a survivor peace of mind. And we also have the ability to offer our breast cancer survivors more advanced forms of breast imaging. And so often I'll see women who are not being followed appropriately. And so that's one of the things that I try to ensure. And by doing that, not only am I doing the right thing for them from a medical standpoint, but I also think it's addressing that their psychological needs, because I think fear and anxiety is something that can plague survivors, even though they're well, they're healthy. But what about their mental health? So there's so many issues really that need to be addressed, and women who are breast cancer survivors need to be followed appropriately. They need to have an advocate. They need to have someone who definitely understands what they've been through and what their needs are.
Great. Doctor, I have a question for you. So
Sure.
for everyone that is watching us, when they look at themselves in the mirror every morning, what are those red flags that tell you,
Okay.
okay, you need to see a doctor?
Okay. So great question. I think that most women will notice a change in their body, in their breasts, often during while they're in the shower, while they're soaping up. That's a great time to feel for changes. Many women who feel things find them when they're lying in bed, and they're just in their nightgown. But in terms of what can you do to be proactive and examine yourself, you can stand in front of a mirror. You bring up a good point. And when you're standing in front of a mirror, it's good to elevate your arms, and that allows you to look at the contour of your breasts. You're looking to see, are there any skin changes? Skin changes could include dimpling. They could be changes that involve the nipple or the areola. They could be discharge. You can press your arms, your hands at your waist. And what that'll do is it'll contract your chest wall muscles. And sometimes there may be a deformity in the contour of your breast that becomes more apparent. You're looking, is there a change in breast size or breast shape? You can then examine yourself while lying down. The important thing is most women say to me, I can't examine myself because everything feels like a lump. And that's very true for most women. And in order to kind of have a sense of what you're feeling, you have to examine yourself regularly. And then you begin to learn what lumps and bumps are normally present. And if something feels different, you would recognize if something feels different. But I would say that if there's ever a concern, whether it's a big concern or a little concern, that's the time to come in and be seen, because we have the technology at our fingertips. Sometimes I see women, they feel something, I can do a targeted ultrasound. Or, of course, based on my examination and my level of suspicion, we can pursue it further. But, any concern, that's the time to come in and be seen, because we can often right here on the spot here at the center image on the same day and get same day results out to women. And that's what's really important.
Thank you so much. Aida, I want to know about your love for Pilates. Tell me why you fell in love with it. When did you feel like this is really working for me? I need to change careers. When that happened?
Well, it didn't happen immediately. As I briefly mentioned, I used Pilates after the surgeries when the doctors allowed for starting active physical activity again, right? And again, my going in was I want to, recuperate my fitness. I was pretty fit still, but my range of motion of the specifically the left side that was with the lymph nodes were taken out and removed was pretty shortened, right? And so I went in doing some privates with a wonderful instructor. And then I fell in love because it really, I started to feel how that part of my emotions that were a little buried and hidden of all that difficult year I've been through started to come out. So I experienced what I see now in some clients that I mentioned. I burst into tears. I don't know what I'm crying, blah, blah, blah. It's the psychological things, but I think was more out of joy, although we're kind of angst tears, right? I was happy the day I started to feel, oh, I can move again. I can do planks again. It's not that it's important to do a plank, but it's what represented for me, oh, I'm getting back to my normal. I'm getting back to feeling strong, to feeling, and the strength coming out of not to show off, but well, when you feel strong, you have, you want to do things, and doing things and being active, is joyful after a year of surgeries and coming in and out of the hospital, right? So it's when I knew that I wanted to do something else with that. But it was 5 years later that I finally opened Alma Pilates. First, I studied right away. Pilates in depth. I got the certification just for me. It was for me like was therapy, right? I was doing my Microsoft job. I was doing my Pilates certification. Was my distraction out of the reality of the stress of the work and going back to work after surgery and treatments, right? Which is not easy for anybody. Then I was younger, and I had 3 little kids, right? School age kids. And it was a lot. It was overwhelming. And just tying with something doctor just said, the psychological part of this is super important. Unfortunately, not all the medical teams in the US, I'm going to talk about what I've seen around, right? Includes the psychology part as part of the treatment. Some insurance don't cover it, right? And that's when I also, because I had nothing else to do, but I loved it and still doing it after 8 years, I volunteered to the there's a team of Cope and Recovery, which is the PhD dissertation and research work to prove that psychological part needs to be part in integral part of the treatment, and therefore the insurance needs to cover it, right, as part of the treatment. The same fashion they cover the surgery, they need to cover psychological help when the patient needs it or wants it, right, without too much approval of it. So I'm still working on that too. So in other words, I knew by then that I'm gonna do something with it. And then the time came, I matured. I kind of said, I love my 30 plus years in the corporate world, but I'm ready for something different. And I just leapfrogged, took a sabbatical. And then 4 years ago, I opened the studio. And I like it. I love it, right? It's like, yes, it's like a second career after 50, right? Or third act, as some call it. But for me, yes, breast cancer was kind of the catalyst of this new career that I found. And it has to do with helping others find that movement that will help them just release the stress or recuperate the range of motion. It doesn't matter where you're going, objective is, at the end, you find it all. And that's important, right? Andrea, you mentioned knee issues, right? We got people, of course, those were one of the issues. I mean, aside from breast cancer, there's so many injuries and situations and conditions, right? Where movement can help you heal, right? And that's what one of my favorite Pilates quotes. He said, movement heals. El movimiento sana, right? Which is not cure. It's not going to cure. Is helps you find your new normal. Whatever the new normal is for you, movement will help you find it and be in peace with it. And peace with it is what brings you the stress levels down. As doctor said, there's no correlation. However, we know stress produces all sorts of ailments that we need to keep it in check. And now with the pandemic and all the things and crazy stuff the world is going through, right? Stress levels are really at all-time highs. So this type of movement also will help you with that, with or without a treatment of any specific condition like breast cancer. Right?
Yeah, definitely movement is super important for your body and for your soul. Like I think it's really important to, to have those endorphins and to really do something for yourself, some self-care.
Yes.
Doctor, all the things that we talk about apply also for to men?
Well, if a man should notice a change, and I have seen male patients, of course, sometimes that they too, they're in the shower, they feel something. So if a man has a concern, they can come in and be evaluated really much the same way a woman can. We do mammography on men, we do ultrasound on men. Men can get breast cancer. Um, so no one should ignore symptoms. It's far more common in women, but that doesn't mean that a man can't get breast cancer. So no one should ignore symptoms.
And I would like to have like why you decide to dedicate your life to breast health.
It's I've always I practiced for many years as an internist, but my practice was always over 90% female. So my interest has always been in female health. I had the opportunity about 10 years ago to work at the Christine Lynn Women's Health Institute. And that's when I started to really appreciate how important it is to address breast health. Breast cancer is very, very common. And, women need someone to go to. There's a lot of anxiety regarding breast health. And I also think as medicine has evolved over the last several years, um, primary care physicians and even often gynecologists don't have time to just dedicate a visit to breast health. And so when a woman sees me, I can do a dedicated consultation on breast health. 1 out of 8 women in this country develop breast cancer at some point during their lifetime. So we're not talking about a rare cancer. Breast cancer is the most common female cancer after skin cancer. So, and of course, much of breast disease is benign breast disease, which is a good thing, right? You can have fibrocystic breast, which is a combination of cystic tissue, little fluid-filled pockets. You can have breast pain as a result. The point is that women have a real need to have a physician address these concerns and be evaluated appropriately. And it was just a niche that was a good fit for me. And I love doing what I do.
Great to have you. It's great to know that
Thank
there's
you.
somebody so specialized like you are.
Thank you.
Aida, I want to know how did you balance your medical commitment during that time and then your family life? How somebody that is going through that can manage both things? And because I know that when you are a mom, the three of us are moms, and like you're a grandma either, like congratulations on that, doctor. They say that grandkids are like the dessert, like the cake for life. So congratulations on that. So when you're a mom, the first thing that you think is about your kids. How do you manage it all?
Well, I was lucky. I mean, I'm thankful because my husband's been a rock and still is throughout everything, right? So I had it easy in that regard, right? He was there for me, taking care of the kids, right? By then, as I mentioned a few times, I was working in a corporation, Microsoft. By then, I was traveling a lot for work. So the kids were already kind of very used to not having me for a full week because I was in a business trip and my husband Carlos taking over all the tasks, right? We always been very good partners in that regard before my disease. When my disease struck, that proved critical. But we didn't have to change a lot of things, right? So I had that luxury of having all that support. By then, my mom lives in Argentina. She's much older now, but by then she traveled when she could to help out as well. My sister also traveled. So I had that support system. And that's exactly um, um, what I think helped me went through this very nicely, I would say, right? Because I mean, without that support, I don't know what I would have done, right? I mean, I was lucky, Andrea. I cannot say that I need to juggle it all. I did not. I could have the time, and one day I was fatigued, I could rest, right? My concern was when I went back to work, because I was in and out with medical leave, depending on the different surgeries. As you might be familiar with, some reconstructions take several steps in and out. So it was a full year with some complications that I had in terms of needing reoperations and stuff. It was not by the book simple. It was complicated in some regards, but I had the support. And I had the support also of a good company. I was employed with an excellent company that allowed me to take the leaves. So in that regard, I was a privileged person, right?
And you made it. So congratulations on that. And congratulations on your Alma Pilates. I think it's fantastic. We're running out of time. So I would like to know if you have anything to say to the audience that I haven't asked, or anything that you want to leave the audience with.
Well, it's October, which means it's Breast Cancer Awareness Month. And I hope that that's a reminder to all women to come in and have their annual screening. There's lots of women that don't come in annually, and it's sad when I see a patient who presents with a palpable mass, which, had she come in for annual imaging, could have been picked up at a very, very early stage. And you don't want to have regrets. Your health is your most important thing, really. It should be your top priority. And often during Breast Cancer Awareness Month, centers such as the one that I work in offer very discounted rates to really help women without insurance come in and get screened. So don't be afraid. I think that happens sometimes. But women need to be aware and not be afraid and come in for annual breast imaging and know your risk.
Really important. Thanks. Aida, you?
Same. She couldn't have said it better. Have your annual checkups, have your mammograms. Don't be afraid. I run into acquaintances, right? Close friends know, they have me there just, nagging them. But let's say, I haven't done it in a year. It's been 2 years now. I'm afraid to go, right? Just go, have your images. Most likely everything's going to be fine. And if it's not fine, well, I'm glad you found it so you can have the treatment you need. But yes, have your checkups. Don't skip on them.
Okay, and my takeaways from the conversation with you is that we have to take care of our body. So we have to make sure that we exercise, because obesity can be a risk, that we have to know our body. Nobody knows our body better than us. So just check on yourself, see how you feel. Take that evaluation, go for your mammogram, check on your friends to make sure that they are doing the same, that they are taking, the steps that they need to be healthy. And if somebody's going through that, ask them what they need so we can help them. And there are fantastic specialists like doctor here, so we have availability for the best in South Florida. So we have to also take advantage of that. I want to thank W.O.W and Baptist Health and T-Mobile and all the sponsors for this. We're running out of time, but if somebody has a question, you can leave it there in the YouTube, and we try to get it back to you. Or if you read any questions there that I don't see, my computer is not working really well. So if you guys see any questions there that you want to answer right now, let me know. Do you guys see any questions? When I try to go to my questions, I disappear. So I just don't want to mess it up. If any of you wants to reply to any question. Yeah, I have a question that they said for your doctor. They ask what is the age for a mammogram if you don't have any history, any risk factors?
So if there's no family history and there's no concern, breast cancer screening for the average risk woman starts annually at age 40. We do, however, recommend that a woman come in at age 30 or 35 for breast cancer risk assessment, because once again, there are other risk factors aside from family history that can play a role in the development of breast cancer. We want to identify women that we may need to start imaging before the age of 40. But for your average risk woman with no family history and no concern, she would start annual imaging at age 40.
Okay, fantastic. Okay, thank you so much. Thank you so much, doctor. Thank you so much, Aida. I will
Thank
go
you.
and try that Alma Pilates. And
Just
then
come on in
I go every
anytime.
year to do all my exams. They told me last time I went there, like I go to Baptist Health for my annual checkup. And they told me, no, you're not 40 yet. You cannot do it. I'm like, it doesn't matter. I want to have it. Just I want to have peace of mind. And they're okay. So they did it. They did the whole thing. And they told me about the density that you're talking about. So they did
Yes.
also the ultrasound. Thank God everything was good. So I'm really glad to know that there are like experts like you in the city around. Boca Raton is just a corner from Miami. And I have to go to El Doral to do Pilates with you.
Yes, anytime. You're very welcome. You're very welcome. And,
Thank you
for
so
those
much.
women that we talk about getting active, I mean, Mind Body Social, the team that organized this as well, they had plenty of daily, not even weekly, free activities that you can always join. Yoga, Pilates, Zumba, you name it, right?
Yes.
Everything there. So there's no excuse not to get moving. Money
It's
is not an
fantastic.
excuse. It's
They are
free.
having,
To move is free. Okay?
yes, it's free. Where tomorrow I'm gonna be in the Everglades doing yoga with Pia
Exactly.
Yoga. So the fantastic thing is like they're doing this from like iconic locations in South Florida.
Exactly.
But everybody can join from their homes, but they have the view. So it's gonna be
Absolutely.
fantastic.
Excellent. So keep moving, and thank you so much.
Thank you.
Thank you, doctor. Thank you, Andrea.
Thank you so much. It was a
Be well.
pleasure. Thanks.